Exercise regularly. A natural powerhouse for lowering blood pressure. Regular physical activity is one of the most powerful natural tools for lowering high blood pressure without medication. In fact, exercise is often referred to as a miracle drug because of its wide-ranging benefits throughout the body. Studies show that consistent exercise can lower systolic blood pressure, the top number, by about 3 to 6 millimeters of mercury, which is comparable to the effect of some blood pressure medications. The key is to make it a habit. Aim for at least 30 to 60 minutes of moderate intensity activity on most days of the week, ideally 5 times or more. You don't have to join a gym or start running marathons. The beauty of exercise is its flexibility. Simple activities like brisk walking, cycling, swimming, dancing, or practicing yoga are all excellent choices. What matters most is consistency and choosing something you enjoy, because enjoyment leads to sustainability. If you haven't been active recently, start slow. Even short sessions of 10 to 15 minutes, gradually increased over time, can make a significant difference. Be sure to talk to your doctor before starting a new exercise routine, especially if you have underlying health conditions. Once you've established a routine, gradually increase the duration or intensity to continue challenging your body. Over time, your heart will become stronger, your blood vessels will be more flexible, and your blood pressure will likely improve. Every step, every move, every session counts. By making exercise a regular part of your lifestyle, you're not only managing your blood pressure, you're investing in a longer, healthier life. Eat more potassium-rich foods to help balance blood pressure. Increasing your intake of potassium-rich foods is a natural and effective way to help lower high blood pressure. Potassium works in the body to balance out the negative effects of sodium, helping to relax blood vessel walls and ease pressure on your cardiovascular system. For most people, eating foods high in potassium can lead to a noticeable drop in blood pressure and reduce the risk of stroke. Some of the best sources of potassium include sweet potatoes, cooked spinach, bananas, oranges, mangoes, and tomatoes. Incorporating these foods into your daily diet is a delicious way to support your heart and kidney health. However, if you have advanced kidney disease or certain medical conditions that cause high potassium levels in your blood, it's important to talk to your healthcare provider before increasing potassium intake. In such cases, too much potassium can be harmful. For everyone else, making potassium-rich foods a regular part of your meals can improve your blood pressure control naturally. Combine this with other healthy habits, like reducing sodium, exercising regularly, and maintaining a healthy weight, for the best results. Try adding sliced bananas or tomatoes to your salads, enjoying a baked sweet potato as a side dish, or snacking on fresh mango or oranges. These small but meaningful choices can make a big difference over time. Remember, managing blood pressure is about a balanced lifestyle. Potassium is just one piece of the puzzle, but it's a powerful one that your body needs to help keep your heart and blood vessels healthy. Reduce salt intake to help lower your blood pressure. Cutting back on salt is one of the simplest and most effective ways to lower high blood pressure naturally. Many people are sensitive to sodium, which means consuming too much salt can cause their blood pressure to rise significantly. By reducing your salt intake, you give your body a chance to relax your blood vessels and improve circulation. Salt is everywhere, in processed foods, restaurant meals, canned goods, and even some bread. That's why it's important to become mindful of how much sodium you consume daily. The key is not to eliminate salt overnight, but to gradually reduce it so your taste buds can adjust over time. This makes it easier to enjoy foods with less sodium without feeling deprived. Cooking at home is one of the best ways to control your salt intake. When you prepare meals yourself, you can use fresh ingredients and season with herbs, spices, and citrus instead of salt. Try to limit eating out or choosing highly processed convenience foods, which often contain hidden sodium. Dr. Blake emphasizes the importance of a low-sodium diet for managing blood pressure and kidney health. He suggests checking out resources like his sodium playlist and cookbook, which provide practical tips and delicious low-sodium recipes. Lowering your salt intake doesn't just help your blood pressure, it also benefits your heart, kidneys, and overall well-being. For many people, this lifestyle change can reduce the need for medication or enhance the effectiveness of prescribed treatments. Remember, small, consistent changes lead to big results. Start by reading food labels, cooking more at home, and exploring flavorful alternatives to salt. Your body will thank you with healthier blood pressure and a stronger heart. Quit smoking to protect your blood pressure and overall health. If you're still smoking, quitting is one of the most powerful steps you can take to lower your blood pressure and protect your heart. Every time you light up a cigarette, it triggers your body's sympathetic nervous system, a part of your nervous system that controls the fight or flight response. This activation causes your heart rate and blood pressure to spike sharply. In fact, a single cigarette can raise your blood pressure by up to 20 millimeters of mercury, mmHg, for about 20 minutes. So, if your resting systolic blood pressure is 130, smoking can temporarily push it up to 150. While one cigarette's effect fades after a while, most smokers light up multiple times a day, which means their blood pressure stays elevated for long periods. This constant strain increases the risk of heart disease, stroke, lung cancer, and other serious health problems. Quitting smoking isn't easy, but the benefits are enormous. Along with helping to lower blood pressure, quitting reduces your risk of many life-threatening illnesses and improves your lung and heart function. It can also enhance your energy levels and overall quality of life. If you want to eventually reduce or stop blood pressure medications, quitting smoking is a crucial part of the process. Many patients find that once they quit, they can better manage their blood pressure with fewer drugs or lower doses. Seek support from healthcare providers, support groups, or cessation programs to increase your chances of success. Remember, every cigarette you don't smoke is a victory for your heart and your health. Taking this step not only helps your blood pressure but adds years of healthier living. Lose weight or maintain a healthy weight to help control blood pressure. Managing your weight plays a crucial role in controlling high blood pressure naturally. Although losing weight can be challenging, even a small reduction in body weight can lead to meaningful improvements in your blood pressure. Research suggests that for every 1 kilogram, about 2 pounds, of weight you lose, your blood pressure can drop by approximately 1 millimeter of mercury, mmHg. While this might vary from person to person, the overall trend is clear. Carrying excess weight puts extra strain on your heart and blood vessels, making it harder to maintain a healthy blood pressure. If losing weight feels overwhelming, don't worry. Just preventing further weight gain is already a positive step. Maintaining your current weight without adding more pounds can help stabilize your blood pressure and reduce your risk of developing other health problems. Healthy weight management involves a combination of balanced eating and regular physical activity. Focus on incorporating nutrient-dense foods such as fruits, vegetables, whole grains, and lean proteins into your diet, while minimizing processed and high-calorie foods. Pair this with consistent movement, whether it's walking, swimming, or any enjoyable activity. Remember, weight loss doesn't have to be drastic or rapid to make a difference. Sustainable changes over time are more effective for long-term health. Celebrate small victories like choosing a healthy meal or going for an extra walk. It all adds up. By working toward a healthy weight, you're not only helping to lower your blood pressure naturally but also improving your overall cardiovascular health and quality of life.